I think working in rural healthcare is unique. It's definitely the environment, the atmosphere, the small, I call it small, yet it's big. The smaller community is very personalized. People support in every which way they can. The co-workers, we're one big team within the facility, and I also think of that in community. The community is one big team, so no matter what's happening or what's going on for anybody, people always pitch together.
You become almost a tight-knit family. You get to know everybody. I have an outstanding relationship with our clinical partners. I call them our partners because they look after the patients, we look after the building, and if it wasn't for the patients, we wouldn't have a building. If we didn't have a building, we wouldn't have the patients, so we're partners. And I think that goes for, whether you're talking about dietary, pharmacy, environmental services.
If you have a sick day, you're getting the text from a coworker sincerely asking if you're okay, wondering what's going on. We really do support each other.
Because we can work together and we can also play together. And that brings the closeness. That's another really unique thing.
I get this opportunity to work with people in a hospital where they're at when they're hurting, but then I also run into them at the grocery store. And you get that connection with them that just gives a quality of care that you don't necessarily get when you're just kind of cycling through.
Working in a rural community makes a big difference to everyone who lives in rural centers because of accessibility to high quality healthcare. There's no need to travel with a sick child or an ill parent to get quality healthcare. It's basically in their backyard.
I've had patients say that it feels like home, and I don't think you get that in a large facility where it's just so many people.
In a day, a patient of mine could be my child's homeroom teacher, or my husband's hockey teammate, or even my coworker's parent. So you really get to be a family.
Community, and whether it's the community of your coworkers or the community that you live in, when you're able to know little bits and pieces of everything about it, that just, I don't know, there's no hustle and rush, and
there's a peace here that you don't quite get when you're surrounded by buildings and traffic. And people are friendly. Daysland is a special little town. They have really nice walking trails that I have definitely so enjoyed, and it allows for kind of that mental health piece, that recharging.
I think this facility is a pretty great place to work.
My career as a rural nurse has been a rewarding profession, my home away from home.